Very good morning, everybody. Today's topic is fluorides in dentistry. We'll be starting this unit today, and this topic is a very important topic from your exam point of view. We'll be covering the entire unit in the next 4 to 5 sessions. Today's first session is on the basic introduction regarding what is fluoride and the historical aspects in relation to dentistry. As you all know, fluoride is an element. It is a member of the halogen family with the atomic number of 9, atomic mass of 19. It is a pale yellow-green gas at room temperature. It is a very electronegative element and hence it is extremely reactive. Coming to the natural sources of fluoride, fluoride is found in the food that we consume. The rich sources of fluoride include fishes like salmons and sardines, tea leaves, potatoes, cereals like jowar, fruits and vegetables grown in fluoride-rich water, and drinking water with very high fluoride content. This is especially a matter of concern in a country like India where you have naturally occurring fluoride-containing water, and that is one of the principal causes for fluorosis. So when we talk about fluorides in relation to dentistry, you must have already heard about fluorides in two contexts. One in relation to a disease known as fluorosis. You must have heard of dental fluorosis and skeletal fluorosis, which are all toxic manifestations of fluoride toxicity. And you must have also heard of fluoride in relation to your dental materials where cements like glass ionomer cement have fluoride incorporated for caries preventive effect. So there are two reasons why you need to know about fluorides in dentistry, because fluorides in low concentration is therapeutic and in high concentration it is toxic. Hence fluoride is always considered as a double-edged sword in relation to dentistry. Let us begin with the historical evolution of fluoride in relation to dentistry. It started from the year 1901, and the period from 1901 till date can be divided into four phases. The first phase is called the phase of clinical discovery, which was from 1901 to 1931. The second phase is called as the epidemiological phase from 1931 to 1942. The third is called the demonstration phase from 1945 to 1954. And the fourth is called the phase of technology transfer from 1954 to today. First, let us discuss about the phase of clinical discovery, which began in 1901 till 1931. The person you see here is Dr. Frederick Mackay. He was a young dental school graduate during 1901. He started his dental practice in a place called Colorado in USA. And Mackay was surprised to find that many of the patients visiting him in Colorado had a distinct brownish discoloration on their teeth, or a brown stain on their teeth, which was locally known as Colorado stain. Some of the stains were so severe that it had a color of chocolate candy, and he gave it a name, mottled enamel. So Mackay tried to find out a mention regarding the stain in the available dental literature and his textbooks, and he could not find any mention of such stains ever. So in the year 1902, he tried to investigate the reason for the stain, and for that he sent letters to various other dentists practicing in that area. That area was known as the Rocky Mountain area, but he hardly received any reply. Even though the study was a failure, that was the first time a systematic endeavor to investigate this staining was done. In the year 1905, Mackay moved to another place called St. Louis to practice orthodontics. He stayed there from 1905 to 1908, but surprisingly, over these 3 years, he did not find a single case of mottled enamel or the stained enamel. So once he returned to Colorado in 1908, this problem, he was more keen on analyzing the cause for this problem, and hence he presented the case of mottled enamel at the El Paso County Odontological Society meeting and also at the State Dental Conference at Boulder. So once he made his presentations at these two gatherings, he got to know that there are many other dentists who have observed similar stains in their respective patients but had not bothered to report it. So with this, he decided two things. The first thing is he wanted to geographically map the area where mottling was observed. And secondly, he wanted the help of a qualified research worker to carry out further research. And a very famous research worker during that time was Dr. G.V. Black. So Dr. G.V. Black agreed to visit Colorado the next year, that is in 1909. So over a period of 1 year, from 1908 to 1909, Mackay, along with two other dentists, Dr. Isaac Burton and Dr. Fleming, examined 2,945 children in that area and concluded that 87.5% of the children had this mottled enamel. And this report was given to G.V. Black in the year 1909. Then the studies were going on. One important observation by Mackay was in the year 1912, where he found a letter written by Dr. J.M. Eager in Naples, Italy, where he also observed similar type of stains, and he had named it dentidicea. So this led to an inference that the stain is not restricted to Colorado but also seen in other continents as well. In 1916, yet another important observation as a part of an ongoing research was that there were two cities. One was Britain, the other is called Bauxite. Both were cities in the US. And it was seen that people who were born after 1898 in Britain and 1909 in Bauxite only had mottling. And incidentally, these two places had changed their routine water supply, drinking water supply, from shallow well to deep well in these 2 years. So this led to a vague assumption that the mysterious element responsible for the staining is present in drinking water. The next update was in the year 1931, that is almost 30 years after the investigation on this staining started. In the year 1931, this is Dr. H.V. Churchill. He was a chemist working for Aluminium Corporation of America located in Bauxite. During his routine investigation of water samples from bauxite, he found out that the water has very high concentration of fluoride, almost 13.7 parts per million. Parts per million is a very relative unit. So when you talk about a solid dissolved in liquid, 1 milligram of solid dissolved in 1 liter of a liquid constitutes 1 parts per million. So he found that there was very excessive amount of fluoride in the waters of bauxite. So Mackay sent the samples from all these places where he saw staining, and everywhere it was seen that fluoride was in excess. Thus, after 30 years of research, it was finally concluded that the mysterious element responsible for mottling is fluoride, and hence the name dental fluorosis was coined. So that finishes the first phase. So it took 30 years, so 1901 to 1931, known as the phase of clinical discovery. Next phase is called the epidemiological phase, which began in 1931 after it was discovered that fluoride is responsible for mottling. And by that time, Dr. Frederick Mackay grew old, and the US Public Health Service appointed a new person called Dr. Trenley H. Dean to carry out the research activities of Frederick Mackay. So once it was established that fluoride is the cause, the first thing that needed to be established is to know what is the relationship between the concentration of fluoride in drinking water and severity of fluorosis. That is known as the dose response relationship. So the first objective was to know the effect of concentration of fluoride in drinking water and the severity of fluorosis. So for that, Dean with his co-workers over a period of 3 years from 1931 to 1934 examined around 5,824 children from 22 cities in 10 states of USA. And this study is referred to as the shoe leather survey, a very important short note exam question for your examination. So this study is also known as the Dean's 22 city study. The main objective of this study is to know the dose response relationship, and it was found that the severity of fluorosis was directly related to directly proportional to the concentration of fluoride in drinking water. So when the concentration was around 3 parts per million or more, the mottling was present. At 4 ppm or above, there was pitting of enamel in addition to mottling, and at 2.5 to 3 ppm, there was a dull white chalky appearance, and below 1 ppm, there was no change observed. This study is known as shoe leather survey because shoe leather epidemiology is a general term used in epidemiology to denote any door-to-door survey. So this was also a door-to-door survey. At the end of this study, Dean developed an index for measuring fluorosis. It was known as the Dean's fluorosis index, which was a 7-point ordinal scale index. Later on, Ainsworth in the year 1933 observed that caries prevalence was markedly lower in areas with low concentration of fluoride compared to high concentration of fluoride. And Dean also observed that around 22% of the children in the area where fluoride concentration was 1.7 to 2.5 ppm were free of caries compared to around 4 to 5% in concentration of 0.6 to 1.5 ppm. So this led to another vague assumption that there is some relationship between fluoride and dental caries. And to confirm this, Dean again conducted the Illinois city study. There were 4 Illinois cities selected: Galesburg, Monmouth, Macomb, and Quincy, with the water fluoride levels at 1.8 ppm, 1.7 ppm, and 0.2 and 0.2 ppm. This was the fluoride concentration of the drinking water supply. On examining around 883 children, it was observed that the caries in Galesburg and Monmouth was less than caries in Macomb and Quincy. So this led to another hypothesis that fluoride has some role in preventing dental caries when it is at a low concentration. And this was further confirmed by an extensive survey involving 7,257 children in 21 cities of USA with fluoride ranging from 0 to 2.6 ppm. And this study, conducted between 1939 and 1942, is known as the 21 city study, not to be confused with the 22 city study. The main objective of the study was to know the relationship of the concentration of fluoride in drinking water and effect on dental caries. And based on this finding, the milestone discovery in preventive dentistry was made, that is, water concentration of 1 ppm in drinking water had a maximum chance of reducing caries with a minimum chance of causing dental fluorosis. And after this study, Dean modified his index and developed a modified Dean's fluorosis index, which was a 6-point ordinal scale compared to the 7-point ordinal scale given in the original index. So this ends the phase of epidemiology, where epidemiological studies were conducted. The important studies include the shoe leather survey or 22 city study, the Illinois city study, and the 21 city study. The next phase is called the demonstration phase. So following this milestone discovery, the US Public Health Department for the first time decided to artificially fluoridate the water of a place called Grand Rapids with a 1 ppm concentration fluoride, and the town of Muskegon was selected as a control, and this fluoridation was done on 25th of January 1945, and it was seen that after 10 years the caries experience of Grand Rapids was much less than caries experience of Muskegon, and this study is known as the Grand Rapids Muskegon study, the first water fluoridation study. Following that, numerous other studies were conducted, wherein Newark Kingston study, Evanston Oak Park study, Teal Coulomberg study, Canadian study, New Zealand study. These are all various water fluoridation studies conducted across the globe, and all these studies prove that water at concentration of 1 ppm in drinking water, the concentration, there is maximum chance of reducing caries with a minimum chance of causing dental fluorosis. So this phase from 1945 to 54, where all these studies were conducted, is known as the demonstration phase. Following that is a phase of technology transfer, that is from 1954 to present. It is so even to this day, this phase means the results of this demonstration phase were applied to the phase of technology transfer. Fluoride started getting incorporated in various products for prevention of dental caries. So that is a brief history of dental caries. A brief history of fluorides in relation to dentistry. And this is a main question that can be asked in your university examination. So with that, we end the first unit on fluorides, that is the brief introduction to what is fluoride and history of fluorides in relation to dentistry. Thank you.